Thank you very much for the invitation to the meeting. My name is Sunao SHOJI, Department of Urology, Tokai University School of Medicine. Today, I will present the high-intensity focused ultrasound, how I do it. This slide shows our university and hospital in Japan. From the hospital, we can see the Mount Fuji very well. Please visit us. HIFU produces ultrasound waves generated by a spherical transducer, delivering ultrasonic energy to point forcing. The thermal and mechanical effect of HIFU cause destruction within the prostate. Because distinct margin between the treated and untreated area observed, HIFU has been regarded as an attractive modality of focus therapy of the prostate cancer. Previously, the long-term oncological outcomes of foreground HIFU were reported. This slide shows the long-term oncological outcomes in patients treated with foreground HIFU in our institution. Biochemical disease-free survival rate in the patient with low, intermediate, and high-risk group were 80.4, 65.6, and 61.6% respectively. By the development of multiparametric MRI and target biopsy, the concordance was reported from 90 to 95% between index lesion locations on biopsy and radical prostatectomy specimen in previous studies. Based on the diagnosis of significantly prostate cancer, focus therapy for localized prostate cancer has been designed to treat significant cancer with minimal injury to the urethra, sphincter, neurovascular bundle, and bladder neck. In focus therapy, accurate treatment planning and accurate treatment are important factors. MRI Trust elastic fusion image guided prostate biopsy has been achieved high detection and accurate spatial diagnosis of clinically significant prostate cancer in the prostate. By the result of the fusion image guided biopsy, the treatment planning was set for the accurate recognition and treatment of the target lesion. The treatment range included at least double treatment volume for the target lesion. Recently, we started the MRI transfusion image guided focus therapy. The method has some challenges to overcome. We believe the new technique would contribute to development of focus therapy with HIFU. We measured and reported volume of prostatic swelling during HIFU. The median percent volume increase was 18% for the transition zone, 9% for the peripheral zone, and 13% for the entire prostate, of which due to diffuse stromal edema in the prostatic tissue in pathological findings. For the accurate treatment, we used an interprocedural transrectal compression technique to suppress prostatic swelling and shift of target lesion during HIFU due to diffuse stromal edema. We reported morphometric changes of the prostate by the conventional procedure and compression method. We could suppress prostatic swelling by the compression method. In the long-term oncological outcomes, the biochemical failure survival rate in the patient treated with compression method was significantly higher compared with those treated with conventional procedure. I introduce our clinical data of focus therapy with HIFU. Patients who had been treated from 2016 to 18 and who had serum PSA level with and less than 20 nanogram per ml, significant prostate cancer that had been located using MRI truss, elastic fusion image guided transperineal prostate biopsy, and 12 core transperineal systematic biopsy. No bilateral cancer with Gleason score above 7. As pre-procedural management, enema has been used to prevent difficult insertion of the device probe and invisible translator ultrasound image. Just before the treatment, antibiotics has been administered intravenously. The diagnosed localization of each multiparametric MRI visible significantly prostate cancer was converted to the treatment planning screen of the truss image on the HIFU workstation three-dimensionally, and the treatment range was determined. Transrectal focal HIFU treatment was performed under general anesthesia based on the intraprocedural ultrasound image, and the energy output can be adjusted intraoperatively. We recognize the popcorn phenomenon shows a sign of effective treatment. As post-procedural management, catheter was removed within 24 hours after treatment in all patients. NSAID were rarely used for the patient after the treatment. During follow-up after the treatment, dynamic contrast-enhanced MRI was taken at 2 weeks after the treatment to evaluate blood flow in the treated area. Serum PSA, function, and quality of life were measured at every 3 months after the treatment. Multiparametric MRI, MRI transfusion image guided target biopsy, and 12-course systematic biopsy were performed when the biochemical recurrence was diagnosed. Oncological outcomes were evaluated by Phoenix S definition and biopsy result. Our study cohort included 180 patients. The characteristics of the patient are detailed in the table. The median age was 70 years, and median PSA level was 7.11. Patient number of low, intermediate, and high-risk classifications were 48, 82, and 50, respectively. The median procedural and HIFU ablation time were 48 and 24 minutes, respectively, and median treated volume was 10 cc. Catheterization and hospitalization times were within 24 hours after treatment for all patients. In the present study, the treated areas were completely devascularized on dynamic contrast enhanced MRI at 2 weeks after treatment, and was seen on multiparametric MRI to have developed fibrosis at 6 months post-treatment, as verified by pathological findings in follow-up biopsy. Of the patient, 8.3% were diagnosed with biochemical failure during the follow-up period. Of the patient, 8 patients were treated with refocus therapy using HIFU. Longitudinal changes in urinary and sexual function. Urinary function significantly impaired at 1 month after treatment compared with pre-treatment value. They improved to baseline and did not significantly differ after 3 months of the treatment. Erectile function was significantly impaired at 3 and 6 months after treatment compared with pre-treatment value, but improved to baseline at 6 months after treatment. I would like to introduce another clinical study from our institution. Using same patient series, the urinary effect of the treated area was prospectively evaluated in patients who were treated by focus therapy with HIFU. Multivariate logistic regression analysis revealed that low maximum flow rate in pretreatment and anterior transition zone treatment was independent risk factor for the deterioration with a larger than 32% of preoperative status of maximum flow rate. Take-home message. For the successful focus therapy, accurate treatment planning and treatment is important. Also, our clinical data of focus therapy is expected. Further large studies are required to verify oncological and functional outcomes from this treatment for patients with localized prostate cancer. Thank you very much again for the invitation. 谢谢。